Yes, so today again we are in theater and we have a liposuction and BBL surgery. The patient is in theater. Very soon we'll be done with surgery and we have to make sure that patient is very, very comfortable. Patient has to be comfortable. We don't want our patients to feel pain at all. And we've always mentioned that PCA, patient-controlled analgesia, is what we use. Now, as you can see, this is the kit that we use to prepare our analgesic drugs for PCA for the patient. You can see this is part of the kit. You can see this particular one. This particular one is part of the kit. This is where the patient would usually press at a minimum of 15 minutes interval when he or she is feeling pain. This will usually release a bolus of the analgesics into his or her system. So this is the kit. Now I'm going to be using just two analgesic drugs, and something for vomiting. This is paracetamol. I'm going to be using paracetamol. 1,500 milligrams of paracetamol. This is an opioid. This is fentanyl. I'm going to be using some doses of this. A very notorious common side effects with opioids is vomiting. But fentanyl, morphine, very, very good analgesic. This is ondansetron. This will be added to the PCA to help us to reduce or to knock out vomiting completely in the patient. So I'm going to break these ampoules of injection, withdraw them, and put them inside here. Now, to give us the right strength or concentration, this is fluid. This is normal saline. I'm going to add some quantity of this into the PCA pump. I'm done with preparing my drugs. Let me show you where I would introduce the drugs into the pump through. This portion. This portion. You can see it has a cap. I've opened it so that I prevent backflow while I'm preparing my drugs. This is like a valve. This is like a stop. So it comes this way, but I will have to lock it so that there is no backflow while I'm pushing in my drugs here. I've started withdrawing my drugs. Then I'm going to push it in this way. Can you see it? Good. I'm going to repeat this process several times until I'm done pushing in all of my drugs and the required quantity of normal saline that I would want to add to it. I'm withdrawing another medication. This is paracetamol that I'm withdrawing. Withdrawing paracetamol. Once I'm done, I push it into the PCA pump again. Okay, so I'm done with my medications. What I'm doing now is to put in the required quantity of normal saline to make it up to the volume, right strength and concentration of the respective medications in my PCA pump. So normal saline, I withdraw. Once I withdraw, make sure I expel the air in the syringe so that as much as possible I don't have air column in my PCA pump within my medication. So I withdraw and I add it until I get the required quantity. So currently we have the right quantity of fluid here. You can see that balloon thing inside the outer container of this pump. That is where our medication is with the normal saline. That's one. Now there's a probability that as much as I've been very careful, I would have air column trapped as my fluid goes out. This is the exit. This is the point at which it will be connected to the patient through the IV line. What I would do next is to open this up. So I would open this up. Once I open it, I told us about this valve. this stop cock. So I will release this so that under pressure from here, my fluid can start to flow. My fluid can start to flow. And as it flows out as if it were going into the patient from here. So as it flows out, I'll watch out for air column within this tube. I will watch out for air column within this tube. I will allow as much fluid as possible to flow out. As it flows out, the air column is expelled. Once it is expelled, I fix this one back, wait for patient to recover from anesthesia after surgery. Then we commence the PCA for the patient. So over the next 1 to 2 minutes, I'm going to allow this to flow out. I'm already seeing air column. Once the air is completely expelled, it's good for use. Okay, so now, for every infusion, for every medication that you give your patient, for blood transfusion, for example, you should document appropriately. For example, if you are going to transfuse a patient with blood, you would see that the blood bag has the name of the patient, a few other parameters, the gender, the age of the patient, the blood group of the donor, the blood group of the patient, that is of the recipient. It will also have things like the date the blood was collected and the expiry date of the blood in the blood bank. So in line with that, the PCA pump also comes with this label, where we put the name of our patient, the age, and what medications are in the PCA pump, medications and their doses, and for how long it is supposed to run. Now, for what I've prepared, my medications will run for 24 hours and it's going to be at 8 mils per hour. 8 mils per hour. In cases where patient will need bolus, when patient has breakthrough pain, like I said, there is that part of the pump where he or she can use this to control a flow in of bolus of the medication. So at the end of the day, around 22, 23, 24 hours is what this will run because of the need for the patient to, at some point in time, at every point in time when he or she feels the need, to push in more bolus of the medication. So with this, for any major surgery at all, as long as we don't have a contraindication to using patient-controlled analgesia, especially with respect to the use of opioids, major surgery, post-operative pain control, especially in the immediate post-operative period, first 12, 24, 36 hours. PCA is the answer for post-operative pain management. PCA is key. Other modalities may come in, oral analgesics, IM analgesics, and the likes. But the mainstay in the immediate post-operative period is your PCA, patient-controlled analgesia, that comes with a combo of different classes, doses, strengths of medications.